Okay, welcome to our small group discussion on difficult patients. We are Indiana State University Doctorate of Athletic Training students coming together to talk about our experience with difficult patients and what we've now learned and we're going to use and promote in those difficult patients. I'm kind of excited to hear what you guys have faced. Just to preface this, because I know our very first question was talking about our own like difficult patients. And I feel like when I was asked that question, I'm like, where do I even begin? And then I got to thinking, I'm like, well, that wasn't really his fault. And well, he wasn't being difficult. Like, this was a coach problem. And I liked the question because it made me, I don't know. I feel like it's so easy to get caught up in feeling burnt out, a lot of the things that they talked about. But I was really surprised to realize that had more to do with the people that I work with and not the patients that I'm encountering. So I'm excited to hear your guys's. But to kind of kick off the conversation, one that came to mind was I had a patient. It was in practice. A really small thing had happened. This was more recent. It's like beginning of football season. He had gotten turf burn like on his elbow and it was bleeding like everywhere in practice. And he was carrying on and like, really upset about the whole turf burn thing. Sorry, he's like a freshman. So, imagine the personality. I got my stuff ready because I knew we were about to take a water break and he was like kind of took himself out of whatever drills that they were running. When he went over to go get some water, I kind of intercepted him and said, hey, let me wrap that up really quick. And he was like kind of blew me off and started walking. So I didn't think he had heard what I said. I said, hey, use his name. I was like, let me wrap that up really quick. And he like, he like freaked out and was like, I don't want an effing Band-Aid, like created this entire scene. And so that was ridiculous. This is such a ridiculous situation, but I can count on my hand how many times I've ever been sworn at by anybody ever. And there was like an immediate, I don't know, I think like the teacher mode, like you're in trouble now, you can't say that to people, took over and the medic kind of went somewhere else, and I said, hey, I mean, I almost went mom mode, I guess. I think that's my mom voice came out. And I yelled at him back about being disrespectful, which is ridiculous. And then a little while later, his coaches made him come back over and he was like, all right, I'll take the Band-Aid now. And I was like, no, you can't handle conducting yourself in a professional manner. I'm not going to treat you. And I know it's over a Band-Aid, but it was so, walking away from that situation, I was so emotional about his response. And that was the thing that kind of came to mind for me, because I don't think I'd had an interaction like that before. And I've never responded to any person that I'm aware of that way. I don't know. So anyway, that was my encounter.
So what do you think that you could have done better in that situation?
I should not have matched the teenage boy's emotions. It was unwarranted on his part, and it elicited an unexpected response in me. And so I needed to, what was that one thing that they said in one of the readings we had was, basically don't react. They had a cute way of saying it. I just can't think of how it was, but I wish that I would have just paused for a second and kind of resolved all of the initial emotions that had caused in me. And when he came back to get treated, and get wrapped, I should have taken advantage. And this is also a teacher thing, not to keep bringing that in, but that was a good opportunity to have a discussion about how he reacted, how it wasn't okay, how you should respect people that are there to help you, and kind of have both a teacher moment and a medic moment with him. And instead I shut him down. I withdrew. I refused care and, you know, all of those things. So definitely would have taken the opportunity when I had it to educate and promote and advocate. And, you know, I don't know, I always think about, we're helping this population become better adults, and I chose not to. So
So a
You know,
couple.
when I was, oh, go ahead.
No, I'm sorry. No, go ahead, please.
Okay. I just, when you said like you felt those emotions coming over you, when I was reflecting on difficult cases and difficult patient interactions, a lot of them boiled down to emotions on my part.
yeah.
So when you mentioned the emotional side, a lot of the cases where I felt, you know, that I initially was thinking about when I was reflecting on difficult patients, it wasn't necessarily the patient's response that made it difficult. It was my emotional response that I wasn't moderating well in those situations. So I relate a lot to that part
Well,
of what you described, Jody.
I appreciate hearing that, because it's so, I was almost embarrassed that was, it's obviously weighed on my mind. I was embarrassed that I even have a moment like that, because I mean, honestly, my personality is usually very controlled, I'm very purposeful in almost everything that I do. I've never been someone that flies off the handle over anything. And you're right. Even any other thing, it was more of like my emotions to what they were saying, whether I was hurt or disappointed or, you know, whatever. Those are still emotional reactions. And, you know, like the readings remind us, I know we've all heard it before, it is not, even if the patient allows certain things or elicits certain responses or, you know, whatever, we can only control our emotions to it. And so it comes down to how we handle ourselves and how we can control ourselves.
Yeah, to go along with that, I was thinking like when we were talking about difficult patients, like what makes it a difficult patient? It's like how we perceive a difficult patient. So like I could have a difficult patient, but someone else would be like, oh no, they're fine. So I think it's all of our perception of the events that are happening.
Definitely.
Yeah, perception is so key from that. That's a really good point.
And how we perceive the situation too, because you said it was just a little small thing, but to him, like being a freshman in a football team, sometimes they're there and they feel like they have to prove themselves. And being, I mean, just from my experience with the high school football team when I was there, the guys have to prove themselves to the older guys. And so maybe getting wrapped up was showing a sign of weakness, or
Maybe.
Dan, I can see your little smirk going, but it's almost a sign of weakness, and having to stop and get his arm wrapped, maybe, you know, it wasn't about the burn at all. It wasn't about the turf burn at all. It was just simply the fact that he didn't want to appear weak to the rest of the players, and you're like, I'm just here to help you, okay? Yeah. Like, just take what I have to say.
Take the epic Band-Aid.
Right, you didn't want the epic Band-Aid, first of all, so take it. But
Or
honestly,
maybe he had,
in their mind, they don't even realize that it's there.
Mm-hmm.
Maybe he had flunked a test, or maybe he didn't get enough sleep because his parents were fighting the night before, or we kind of have to take, when my reaction when somebody has a very strange kind of like anger or like a boil up or an emotion, a strange emotional reaction, mm-hmm. What I do is I like that metacognitive, you take yourself out of the situation, you just kind of think like, what else could this be? And like my brain, for whatever reason, goes right to that disablement model of like, what other factors besides that very minor, from what it sounds like, very minor turf burn, mm-hmm. Why would they have that response? And Megan's exactly right. It might be that he's trying to prove himself, or maybe he just had a bad night and he needed somebody to talk to, somebody to just mm-hmm. say, hey, it's okay. Let's just take this, get this taken care of so you don't get a defection or you don't get something from somebody else mm-hmm. because of an open wound, you know, something like that. Yeah.
And the first thing that like comes to my mind, Jody, you're talking about your emotional response to this. Like my like personal emotional response sometimes to that is, well, why do I have to just let it go? Like, why can't, you know, why do I have to get my emotions in check? Why do I have to be the bigger person? But the whole like purpose behind what I do is to provide that care. And especially with this age, with the kids at the, the patients that are children or minors. But there's always so many other things going on. Developmentally, they're at a certain stage. They're at, we all remember what high school is like. And so there's almost so many other factors playing into it. What if I had a bad night? But it really, like, being in this field and being in this profession, I think, is almost like you really have to put yourself aside a lot of the times. And it can be frustrating. It can be hard. I don't want to be humble or like selfless. I want to snap at people when I've been disrespected. But in those moments, it's almost like it's a cool thing to be a part of this field, because in those moments you could have had that moment of like teaching him, or you could have had that moment where you have a patient come back to you and say, hey, you said this one thing to me and that changed my whole day.
Well,
and so it's little moments like that are really cool, but then like also it can be really frustrating.
Well, and when they take and this is going to sound ridiculous, I don't want anyone, it's hard, I think, for people, I don't know, I guess for us, when they take your human away, like that you're at their disposal, or that, you're not needed or you're not wanted, and you're, so willing to give them whatever it is that they need. Not that you're looking for an attaboy, but that you're just looking to be respected as a human being. And that's what even upsets me more. I can understand, I guess, on that level, why that elicited such a strong reaction, was because I very rarely have had anyone take that from me.
Right.
But it was an opportunity to, it would have been a phenomenal opportunity to go a different direction than to just shut down. That made me no better than the teenager.
But you're also human, so also allow yourself grace there. But yeah, at the same time, those situations can be really, really frustrating. And I've learned that I have to put my ego down sometimes, and I don't like doing that all the time.
I'm really glad you said.
Oh, we're all excited.
So for my research project, I'm doing like if athletic trainers have the ability to cope with like grief, basically. And I read the other day that like in the American healthcare, like they like kind of make healthcare professionals like hide their grief or like hide their emotion. So I think like that goes along with what we're saying. Like maybe like you had a bad day and stuff, and maybe you just need to like know how to express that. And like if we just keep it bottled up in ourselves, that's like a good way to like get burnt out and stuff. So like maybe, like we always talk about the athletes coming to us, or like our patients coming to us and talk about our emotions, but like you need to find like a social like support network somehow that you can get your emotions out, or like debrief, so then you don't have like those weird outbursts that you have no idea why, because you're not like that. So I think that's important too, not to just keep that bottled up, and just like
smart.
If you don't feel like a human, like go and find someone to tell that, or like just go to someone, so then you don't keep it bottled up and get burnt out.
Yeah,
I think anybody in the DAT would be willing to do that too.
Yeah.
As she covers her mouth.
Yeah. Oh, hey.
So anyone else, I'm curious about your guys' experiences.
I have one from when I was at the high school. So in one football season, I had two like crazy tib fib fractures in one season. And it just like never had happened before, and then I got two of them my first season working as an athletic trainer. And so the first one happened 3 weeks into the season. The second one happened about 3 weeks later. And so they're both very similar, both surgically repaired. One of them worked with me and one of them didn't want to. So the one that didn't want to saw how quickly I was working with the other one and how much progress he was making. And this kid was kind of carried himself in a way that he was all that, and didn't need help from anybody else. Comes from, kind of like what Dan was saying, like maybe he had a tough night with his parents. He came from a single parent household, had, mixed family and just not a great background, transferred to our school that year. But one day he came in and he jumps on my table and he goes, "Coach made me come in here. I guess I have to work with you." And I was like, "No, you don't." And he was like, "Well, I guess I effing have to do these exercises, so whatever you have Eli do, I guess you're going to have me do too." And I was like, "I mean, no, you don't. You really don't have to, and if you're going to come in here with that attitude, then I'm not going to work with you." And he goes, "Well, Coach made me come in here, so can you just tell him that I came in and did my thing and went out?" And I was like, "No, I am not going to lie to your coach for you. Like, you're either going to put in the work, or your coach is not going to. Your coach is going to hear from me either way, but I'm not going to lie to it for you." And he was like, "Oh, fine, whatever. I guess you don't even care about me," and walked out of the room. And I was like, "Yeah, like, what the heck just happened?" So I had stomped over to coach and I was like, he just did this and this is what he said. He was super disrespectful. And I was like, can't even believe it. So just so you know, he didn't work with me. And like 2 hours later, he walks back into the room and he goes, "I didn't realize you were so mad at me." I was like, in that moment, I was like, I'm not mad at you. Like, but you came in very disrespectful and it makes me not want to work with you. And he was like, "Well, I want to be doing as well as he's doing. So would you be willing to work with me?" And I was like, "Of course I'd be willing to work with you. Yes, absolutely." And he did some stuff with me that day and then never came back in to work with me. He worked with a PT elsewhere. But I was like so flustered and so like, how dare he come in here and like use me at his disposal when he wants to, just because coach told him to. But in that moment, I really wanted to look at him and say, "No, I'm not going to work with you because of your attitude." So that's the one that came to my mind. I did it reluctantly. I worked with him that day. But my heart wasn't in it. I was just like, "Here's some things for you to do. I don't really want you to be here anymore." And he never came back and he was apologetic. And so like he was difficult at first, but thankfully came back and changed his attitude after coach had some choice words for him, I'm assuming.
So my question is, and not to make you feel for any of you with whatever your story is, but I'm curious, do you think that your apathy, do you think do you think that was received almost, and that's maybe why he didn't come back after that?
It could have been. Absolutely. My response to it, I am very aware that I did not respond well, and my ego, that's my biggest thing. My ego got in the way of like, how dare you come in here and treat me this certain way? Like, I deserve to be treated better than this. Yeah. And it was absolutely could have been a factor. He also did start working with someone outside of the school, and I was very busy. I don't know if that was why, but I also know that the exercises I did was not like individualized to him. I didn't make a plan for him. I just kind of threw out just a general, here, do some things. So yeah, absolutely. It could have been a moment where I sat and taught him, like, this is why he's making progress, not because of me, but because he's putting in the work. And so yeah, it absolutely could have been because of my attitude towards him, and he felt that. Absolutely.
One thing that really jumps out to me, Megan, is that first off, I think that it's not a bad thing that you establish boundaries. So if he is swearing and giving you I don't want to say a hard time, because again, he's a kid.
Right.
But like when I used to work at the high school, I had a rule that there was no swearing. And there was no, I would call them disses, where somebody would say something negative to another person. And if they did do that, they had to step out and come back in with a better attitude. And what that did, it created a culture in my athletic training clinic that kids would actually enforce it themselves. Like I would have a group of football players and somebody would swear and they'd be like, oh, you got to leave and you got to come back in. Or somebody would say something mean, and as a group, they would all say, that was kind of mean. You need to go, you need to step out and come back in.
Yeah.
And it created this really cool kind of culture and welcoming atmosphere, which I think then put me in a better position to help advocate for the patients. So I'm glad that you did the, you told him like, no, I'm not going to, you said no at first because of the way his attitude. But then when he came back and apologized, that might have been a good opportunity to be like, oh, well, okay, what's going on? And have you checked in with him since he started working with somebody else?
So I checked in with him every so often, but he, like, this football season was over and he didn't play any other sports. So I didn't see him very often after that. But I always tried to, like, whenever I would see the kids at the high school when they weren't in as my patients, I'd always try to ask them how they were, not in regards to their injury, because that's not the only thing I care about. And so I think I maybe checked in with him once or twice and like, oh, you're working with someone, that's awesome. How are things going? Or like, how are you doing? So I would, but it was limited. And every time he saw me, he's like, oh, hey, Megan. So it was really like, I had to make a conscious choice of like, how do I want to treat him now as a person too? Not just in regards to healthcare. And like ethically, I can't say no to him, like working with him, because he did change his attitude and he did like come in apologetic and stuff. But it's interesting because I had very similar, like, no swearing and no you're faking it comments, or like, oh, you're just being a wimp, or other words that high schoolers use, to that because you're in here getting help or whatever. And so like they started coming up with very creative alternatives for swearing, which was really funny. And it created that positivity of like, hey, we're in here to get help and that's okay. But I definitely, like, I checked in with him a couple times, but I kind of let that relationship happen on his terms when he came to me, instead of like pursuing that necessarily, because I did have a lot of athletes to like cover, and a lot of patients in and out of the room a lot. So I did when I saw him, but not like, I didn't like go out of my way to see how he was doing.
Nicole, you have to have at least one.
I'm sorry, I'm like sick, so I'm really trying to be quiet.
Yeah, I'm sick. Everyone's sick.
Yeah.
Yay.
No, but I can talk for a quick second. I was trying to think of one, like, I think going back, so I work with a lot of older patients. So I think one thing that I constantly deal with is the fact that they are older than me, so they don't respect me. That kind of makes sense. So like when I worked with younger kids or people that were younger than me, like they kind of had this notion like, okay, she's older than me, so like I kind of have to respect her. But now the fact that I work with military personnel and some of them are older than me, they kind of like look at me like, well, you could be like my kid, you know what I mean? And I'm like, I understand that. Like, thank you for aging yourself, you know. But one thing that like I said, I couldn't really think of one specific one, but one thing that I've been trying to do, because sometimes it is like really negative in the military because they have so much going on. And I know that in one of the readings, they talked about like mindfulness. So I try to do this like 4 square breathing. So like if I have a difficult patient, I will go ahead and like go back to my desk and I like inhale for like 4 seconds, and then I hold it for 4 seconds, and then I exhale for 4 seconds, and then I guess hold that for 4 seconds. And I'll probably do that like 1 or 2 times. So, or even like if the patient's talking to me and like they're getting, like, especially like in their history or something, and they're just going, and I'm like, okay, like you're getting me a little angry, but let me kind of keep talking. I'll kind of do that and like try to change my mind before I reactively say something that might make their time worse or more. And I think one thing that I'm also really trying to work on is I say I know a lot. Like, I know what you're going through, but I honestly don't, depending on what the situation is. So I'm really trying to say, like, I can see that this is upsetting you, and I want to know, like, what can I do to make this better? Or, and a lot of the times too, like, especially in the military setting, like, they don't get hurt a lot, and like it's hard for them to come in and see us. So by the time they get into us, like, it might be 4 or 5 weeks after they've torn their ACL and nobody looked at them, and now they have all these limitations, you know. So don't get to see me for 10 to 14 days. So it's like, you know, I could tell that this is probably not going to be what they want. And again, it's like the military, so it's step-by-step basis, and I can't go outside boundaries sometimes. So I'm trying to figure out and empathetically respond with giving them facts of like, hey, like, if this was outside of the military world, this would be a lot different. And I respect that this upsets you because, you know, your other friends or something have a different experience, and I'm going to try to do my best to give you the best experience, but I'm also restricted because of external factors that I can't control. So I don't know if I like what the biggest thing is the older patients, because they do sometimes like disrespect me, and that bothers me, but I'm doing my 4 square breathing.
You just like, just because I'm not sure, do you ever feel like being a female in that setting, does that ever play a factor? I've recently had a lot of patients make comments about me being female. I had one the other day that asked if the doctor he was going to be seeing was female, and I said, nope, it's Dr. Robert Jones who's going to be in, so he's male. And he goes, oh good, they're better anyway. So do you ever feel like being a female plays a factor into that at all?
It's a really good point. I haven't felt that way. Like, I'm really trying to think of a situation that I felt that way. I think it's because I'm a civilian too. Like, they say ma'am all the time. So like, I think that's very respectful. I'm like, wow, like, thank you. You know, like that's a little different. And I really have a great team. I don't know if I didn't have a really good, like our sports medicine physician, and then I have a colleague. If I didn't have that team, like, I know they have my back, but I haven't experienced that so far, at least. So that's a really good point. But, and I don't know, I think I don't know. I haven't really actually, but that's a really good point. Thank you for bringing that up.
I just wonder because it's so like recent in my brain. I'm like, I wonder if anyone else deals with that like so blatantly.
I'm a little surprised you didn't bring that up as, I guess it's not a difficult patient though.
Well, he was kind of difficult. He was old and difficult, so yeah, that was another one that I have a lot of people making lots of comments in the clinic about how young I am and that I'm a female.
Yeah. So I know this was before we started recording, but my incident with the male injury that happened tonight, my 2 male, it was from the opposing team, the player who was injured, and I saw the incident. I knew what happened. I understood where the injury was, and our 2 coaches, I started to get up to walk towards where the injured player was, just in case they needed me. And our coaches both said, oh, you don't need to go. You can't do anything for him anyway. And I just said, I'm just going to go over to just show concern and see. And the other team's coaches actually called me on the field and wanted my insight and assistance. So Megan, there's a perfect instance where you can't do anything for him anyway. Actually, if there's an emergency situation, I think my presence would probably be helpful. You know, we didn't have that situation, but yeah, that was just one of many. But yeah, I've had that happen so many times. But it's not necessarily with patients. It's usually with, like you said, Jody, it's not with patients that I have the difficulty. It's with coaches or parents or other outside factors, because even working with collegiate patients, if they want to get taken care of, they're going to come to us. I mean, when I worked collegiate football as my football rotation in my undergrad, we had an all-female staff. So our certified AT, who's also our head athletic trainer at our school, was a female, a young female at that. I mean, she was not yet 30 at that time. And we had 7 students, all female, 6 seniors and a junior. And I think it's so important for us to have advocates, but having a female advocate as a athletic training student, it has shaped my career and how I approach not only stakeholders but patients, because our head athletic trainer looked at the team during team meeting and said, if you want to get taken care of, these are the people that are going to take care of you. And the coaches supported her in that, and it was never an issue, not one time that entire season. And so I just wonder sometimes, if I had not had that experience, had it been a male head athletic trainer with 7 female students, would I have had that same experience? I don't know. I just know how much that's shaped how I interact with difficult patients who may bring gender into the equation.
Makes me not want to treat them, because I'm like, oh, you don't think I can do it? Then maybe I won't.
But you got to think about too, I mean, they might come from a household where like their father disrespects their mother, and they might not know really they might not see anything different.
Yeah, it's not malice, it's pure, it's blatant.
Yeah.
He was also 83, and so things were a lot different back then.
Absolutely. That's generational. That's probably acceptable you know what I mean? That's an acceptable way to talk to a female staff member in a physician's office.
I do think it is important that, coming back to setting boundaries and things along those lines, I think in many ways we face those things with people who are closer, as far as like a generational gap. I think that there are different prejudices that we come in contact with that are closer, and that a generation gap is not an excuse to, like, we need to still set up and promote boundaries. It's difficult though if you're trying to maintain a relationship. Like, if let's say you worked with that 83-year-old on the daily, let's pretend that you were his doctor and he showed some distrust, in you. Now you work in a clinic of other people, like maybe it would be, where I was going with that is it's most beneficial maybe for that patient to find another clinician that he apparently values, and that again that would be really, really hard. But putting your ego on the side for someone that just had their prejudice, I think any patient's prejudice on some level sculpts the care that they're going to receive. And I don't mean that like they deserve bad care. I'm just saying, okay, if they feel more comfortable with a male doctor for whatever reason it is, then those are the kind of accommodations that we need to make. If I was working with an 83-year-old on my football team and he wanted a male physician instead of me, I would say, okay, well, I have to make the medical call that you won't be playing now, 83-year-old man on a high school football team. And you're going to have to I can make an appointment for you with so-and-so. And I think that is part of, I know it's not what was talked about, but it is part of setting up boundaries and expectations without convoluting the care that we provide with emotions.
I had a patient in undergrad. So in my undergrad, we didn't really have a certified athletic trainer for swimming and diving for a while. So it was all just kind of like whichever student was in there just kind of got, here you go, here's your patient for the day. So they didn't really have like a fair like treatment type of deal, like a very good quality of treatment. But then they got really jealous and the swimmers started coming in there and kind of demanding treatment. So it was kind of like a stigma among the like students that we didn't really like them because they were all kind of difficult to work with, when in all reality they probably just wanted to be treated. So there was one swimmer or a diver who, he was from Spain, so he was kind of hard to understand anyways. And he had probably like 3 different surgeries on his shoulder. And he would come in every day and I would like, he'd be like, oh, can I do stim? And they'd just be like, well, hook him up to stim. I'd be like, okay. And he was just like, really, every day I'd be like, how are you? And he'd be like, I'm fine. And he just like, he wasn't really ever happy, or like, when we did like rehab with him, he never really like tried that hard. And then one day I was like, well, like, what's wrong? Is like your shoulder hurting, or like, do you just not want to be here? Because you don't have to come here if you don't want to be here. And he's like, I'm just not ever going to get better. And I was like, you know what? If you think you're never going to get better, then you're probably not ever going to get better. Like, that's just the way it's going to go. And then after that, he like thought about it, and he completely changed his attitude, and he like started actually trying and stuff. And then he went to nationals and like won. So that was pretty exciting. That just like me telling him like, you know what? If you think that way, you're not gonna like, just a mental like mindset thing changed like his entire outlook and helped him like get better. So that was pretty cool, I think.
And I think you totally could have done the complete opposite and been like completely never even cared or thought about how he was, you know, asking him why, or like asking him how he was every day, and like really genuinely showing that you cared, and just being like, ugh, whatever, like I'm just not gonna, I have other patients to deal with. Like the fact that you actually took the time and like, hey, like I care about you as a person, how are you, and taking that time, even if it was like a couple of days in a row of like asking him, eventually you got through to him. And I think that's super awesome, because you absolutely could have gone the complete opposite way.
Yeah, I think that's why I finally asked him, because I was getting annoyed with him being like, I'm fine. I'm like, okay, what's it, like, we need to figure this out. Like, you can't waste your time in here if you don't want to be here, you know? So I think was getting really frustrated. I was finally like, okay, what's the deal?
But it turned out good, so that was okay. It turned out really well.
Yeah. One of the preceptors heard me when I was telling him, you know what, you're never going to get better if you act like that. They were just like, one of them was in their office, and I could just hear him laughing. And I was like, the truth. Like, yeah.
That's cool.
What would you have done if he never came back?
If he never came back?
Yeah.
Well, I probably would have felt kind of bad, but then again, like, I just think, like, in life in general, I think it's too short to waste doing things you don't like. And so if he never would have come back, I would have felt like, well, maybe he just doesn't like doing the rehab, and he just like, it's going to affect his competition. So if he's not going to put in the effort, and if he doesn't want to take that time out of his life, that he's never going to get that time back. So he's obviously doing something he enjoys better than rehab. So that's his choice.
So I actually have one with a lot less happy ending. So I was working with he was a 32-year-old man, so about my age, and he had a snowboarding accident 4 years ago where he fractured his sacrum. And when I was quizzing him and taking his subjective history, it was, for the last 4 years, he's had left posterior hip pain with some incontinence issues as well. So like differential diagnosis, like we knew he had a fractured sacrum. So I'm thinking like maybe some pelvic floor disorder, or some glute dysfunction, or even a vertebral neurological inhibition going into the glute, not allowing the hip to go into extension. So I was working with him for about 4 weeks or so, and his range of motion was improving, his strength was improving, all of his clinical outcomes were improving, but his patient-rated outcomes were still like bad, like really bad. And it was frustrating me, because I'm like, you're getting better. Why do you feel like you're not getting better? And I actually put it on him, that I was like, you're getting better, but you're not perceiving that you're getting better. Why do you feel that way? But I kind of like pinpointed it in a way that I never should ever pinpoint something like that. And one thing that I never asked about was his relationship with his wife. So the reason why he wanted to get this taken care of is because he had issues with premature ejaculation and even just getting an erection. So 32-year-old man, like I am 32 years old. I wasn't at the time, I was 29, but fact that he couldn't, it was affecting his personal relationship with his wife. And when I pushed him and I said the way, and I don't remember specifically the way that I said it, but I pretty much blamed him for not feeling like he was improving. And it completely ruined my relationship with him. Like, completely ruined it. To the point where he won't even, like, he comes back to the office, but he will not talk to me. So I understand that you're not going to talk about that with high schools. You might, I don't know. You might ask him about sexual history, but like, that was 3 years ago. And ever since then, I think that's what made the switch for me to get more patient-centered in my care, is asking all of the uncomfortable questions. Like, do you have incontinence? Do you have, are you still having, because I'm working with a lot of elderly people, is it, and making sure that all of those questions are answered. So that's something that really haunts me. That one patient encounter really, really haunts me.
Dan, have you ever tried talking to him?
What's that?
Have you ever tried talking to him again?
Yeah, I've reached out. I called him like a week later. I tried calling him 6 months later. Like I said, he comes into the office and like, I'll walk by and I'll look at him, I'll smile, and like there's like complete avoidance from his point of view. And I don't know if it's him being embarrassed that he told me that, or that I was such an asshole. I look back at this encounter and I'm like, that was probably one of the top 10 worst experiences of my life. Like that, it really hurt me.
Can I ask how did it come about that you found out that he was having difficulty with, you said premature ejaculations?
Yeah. We were in the middle of a session, and it was a reevaluation. And with my reevaluation, usually I review the exercises that we're doing. And I was trying to be like, can you see that you couldn't do this 4 weeks ago, but now it's very easy for you and you're improving, you're getting better, but your mind isn't there. Mm-hmm. And again, I don't remember the words that I used, but I remember the feeling when I said them. I immediately wanted to retract them.
Yeah.
You know, that feeling. Yeah. And he looked at me and he said, "You don't understand. I can't have sex with my wife." And it was like, holy shit, like the world just crashed down. And I was like, there is so much more to this than, it's been 4 years. Like, there's so much more to this than the 4 weeks that I've been working with him. Yeah. And then I was like, tell me more about that. And he's like, I can't get an erection. When I get an erection, it's not nearly as full. And when I do get an erection, it's a premature ejaculation. Mm-hmm. And then from there, like, I had 10 or 15 more minutes left in my appointment, and it lasted maybe another minute and a half, and he left. And I was just like, you just kind of sit back and you're like, what just happened? And it like makes you reflect.
I'm just curious. So just so I understand, because my next question is, not only what could you have done differently with, like, you can't take back like what you said, I'm just wondering if there was anything more that could have been done to keep him, I don't know, like.
Oh yeah, absolutely. I could have asked. That would have, on the front end, if I just asked the question, is there anything else besides being so orthopedically minded of saying you have a left hip obliquity, you have glute weakness, your left hip doesn't go into extension, your sacrum, the apex sacrum is rotated to the left. Like, it made all the sense in the world of why he's having his hip pain and and he did admit to some incontinence, but I chalked that up to, again, that pelvic floor dysfunction but I never really addressed it. That, like, I was too embarrassed to talk to him about it, and as a healthcare provider, that's what really hit home for me is that I failed him in a way that, being a 32-year-old man, I would never want to be failed.
Yeah.
The question that I have, Dan, is do you think that that moment of failure has almost benefited every patient since then because it changed your mindset? Did you
absolutely
grow from that?
Absolutely.
And that's almost the cool part. Like, yeah, that's a big deal. But you decided to change your mindset and to really put in the work to be better. And that's the only thing that you can do from that moment on.
Yeah.
And that's really cool that you're able to learn and grow from that. But yeah, don't let that moment slip you by to like just forget about it because it's awkward and uncomfortable, but use it as a learning and every patient since him, I'm sure, has benefited from you shifting your mindset and being able to ask those uncomfortable questions now and learning and growing from it and realizing what you could have done differently.
Yeah, forgiving yourself. It's got to be tough, and I don't mean to tell you what you might be feeling or create something that isn't there, but it's got to be tough that he still comes in and that you're so close and can't fix the situation. There are so many situations, that story brings up with patients that it's like you can't ever get that back, and you can do as much as you can to recover it, but at the sometimes on a relationship, no matter what kind of relationship it is two ways, and if he can't forgive you for those things enough to like want to trust, that's something you have to forgive yourself for and respect on his part, I guess, but that's got to be tough. It reminds me, on a very, very lesser note, another one of my second difficult patient ideas that came to mind was I had a patient who sprained his ankle in the middle of a football game. I very quickly tried like a mulligan to relieve pain, and obviously did an evaluation. It seemed like a sprain, didn't have a whole lot of laxity, even though you're supposed to wait 4 to 5 days now. Shout out Riviera. But so I did these things, and he was like, no, it's feeling a lot better after the mulligan. So I put him through the functional testing. Everything was great. And his coaches didn't put him back in. Then all of a sudden he started progressively limping. So then of course his coaches aren't putting him in and stuff like that. Fast forward to seeing him the next day or the following Monday. He's like, yeah, well, I lied to you. It didn't feel good. It felt exactly the same. I did what I needed to do and, got through it. I'm like, well, thank you for telling me now. So I was like, yeah, he's super engaged. So I tried, some more techniques, tried some more rehab, really tried to make him feel better. And, he was like, yeah, it's feeling good. And I'm like, I could just tell this is not helping. It's not making you feel good right in this moment. And his dishonesty to make me feel whatever kind of created some frustration on my end, some extreme frustration. So about a week goes by, he's still he's kind of disengaged from rehab because he's telling me that he's totally fine and he's not totally fine. Keep checking in with him. Well, he finally comes to me on game day and goes, can I get my ankle taped? And I was so irritated that he had neglected this whole situation for a week. Even, after multiple, are you feeling okay? Are you sure it's good? I don't need to do anything for pain. No. Game day comes and suddenly he wants something. And so I was like, well, you've been practicing all week at 100%. Why do you need an ankle tape now? And I put it on him that way, not to tell him that I wasn't going to, but to kind of open his mind to how ridiculous it is to just need something on game day. It was like the Band-Aid thing all over again. When am I going to learn my lesson? But I didn't tell him no, I wasn't going to do it. But it ruined, I think, on some level, what little semblance of a relationship there was. It got deflated again because he's like, well, she doesn't want to deal with me anymore. And he's right. I didn't. And I was in control of that, and I should be grateful for any engagement that he was willing to give me, because there's a reason why he's not. And it does have a happy ending, because I told him, or I kind of explored a little bit about, why are you so adamant to go back when you're not really helping your team as much as you could if you were 100%, if you're just honest with me. And I had forgotten that the guy who had played his position the day after he sprained his ankle, I had to call the ambulance to the field to pick up the guy who had taken his place, because he hurt his ankle as well. So he felt like this need to get back fast, not complain, and all of this stuff. So I don't know, it reminds me a lot of that, is you got to forgive yourself for what little, because now that's always in the back of my mind, that even though we ended up having a good conversation, there was a moment, like I came back and I apologized to him. I said, I shouldn't have phrased it to you like that. I was happy that you came in, but and I expressed my frustration that he hadn't been in, and that's what led to the good conversation. But I should have never taken the detour to get to the good place. So I do, for sake of time and all of this stuff, it sounds to me like, oh, sorry. Oh yeah, I'm still on. Well, it sounds to me like our major problems were that can lead to frustration was disengagement, which was something that our readings talked about. Our readings didn't really cover blatant disrespectfulness necessarily as being a barrier to the relationship. And I think that we took the advice that they gave us to talk about how disengagement, or not prejudice keeps coming to mind because I'm still stuck on Nicole's story there, but blatant disrespectfulness, taking as much control as we can back to, well, why are you feeling this way? Or what can I do so that you still get care? Anything else that over-encompassing themes that you don't think we've answered?
So something that I've wanted to interject, I just haven't found a good time, is the idea of communication. So like the title of chapter 10, pretty straightforward. I have it open, but communication is not about speaking, it's about listening. And I have heard I had a speaker, this was when I was in college, and the speaker said, whether Dr. Games always talking about whether you believe in big G, little g, no G, whatever that is, but the speaker said, we were created with 2 eyes and 2 ears, but 1 mouth. And I think when I was reflecting, so Dan, I'm not going to go into the story for the sake of time, but I also had one of those, I said something and immediately it was like, you can't put toothpaste back into the toothpaste holder type of experiences. And it ended negatively. And this was years ago. And that was the patient's freshman year. And I ended up having that student in class as a student. She was just clinically my patient. And then she was no longer my patient. But then I had to have her in class as a student. So talk about difficult having to face them. And it was tough. And frankly, I was relieved when that patient graduated. But it has made me a better clinician. Because I heard a lot of similarities with how I feel, and what I heard, kind of what Megan pointed out to you, was that you don't ever want to make that mistake again, right? And so it's made you a better clinician, is kind of what I heard you saying, and I felt the same way. A very different situation, but that's that very similar feeling. And for me, it's so important, the listening factor. Because underneath those prejudices, underneath the disrespect, underneath the attitude, there's something there. And I find the more I just pose an open question and just sit and find comfort in the silence and give that patient the time. And sometimes it's not appropriate, right? Like you're in an immediate situation, it's emergency, or it's blood on the sideline or whatever. But like if it's a clinical situation, sometimes finding that, giving them 5 seconds of silence and letting them say, giving them that ownership of the moment gives me so much more information. And it makes the interaction more positive, and it de-escalates some of that tension. So anyway, the 2 ears, 2 eyes, and 1 mouth, that always runs in my head, especially when I get frustrated. I have a tendency to want to fill in the void of, want to fill in the silence. And I've had enough of those situations where, insert foot in mouth. And it's like, you're going to be so much more effective if you just stop talking and let the patient guide. I had a patient one time and I was like, okay, we're doing long-term rehab. This person she had torn her rotator cuff and labrum her freshman year as a softball pitcher. And the first day of fall practice, she was doing outfield drills because she could no longer be a pitcher, and she retore her ACL. So she missed 2 full years, her first 2 years of Division I collegiate softball. So this girl is, was a great, diligent patient, didn't want to be there. And I would say, all right, we're going to do blah, blah, blah. We're going to do this next. We're going to go over to the shuttle, and then we're going to do jumps. And she finally, one day looked at me and goes, we're not doing anything. She said, you're sitting on that stool. I'm doing the line hops. I'm doing the wall sits. I'm doing this. So can you please stop saying we? And she and I had a great relationship. But she wasn't a difficult patient, but I'm taking it back to the communication factor, and I wasn't hearing myself. Not only do we need to listen to our patients, but I need to listen to what I'm saying and choosing my words, and taking that one mouth that I have and using it wisely. And so for me, the communication and the listening has been a key factor in working with and coping with those difficult patients. I just wanted to throw that in there. So that's been a really important factor in my learning process throughout my career so far.
Thank you for sharing.
Yes.
Sorry, it doesn't really connect to the other things we've talked about, but it was just like weighing really heavily on me because it's been an important part to me. So
Thank you for sharing. Yeah.
Okay, so anything else someone wants to add? I think that was a really great. Oh, go ahead.
No, I just think it's really cool that all of us have mentioned not only the difficult patients, but I think every single one of us who shared has mentioned how they moved forward from it. And that's all that we can do. And that's a really positive note to end this on, because difficult patients are difficult for, for many different reasons. And the fact that we can all identify how we've moved on and some strategies, seeing how other people have moved forward too, we're just going to continue to be better and better clinicians as time goes on, as long as we're working towards being better.
Mm-hmm.